Hello and welcome back to this edition of Bayou Time. Again, your host, Keith Weissite, licensed clinical social worker. Thank you for joining us. However you may be joining us, we appreciate it very, very much. And you know, it's always good to hear about stories of people who have gone out and done wonderful things and then come back home and be able to take care of people who need that help here in our area. One of those people, an author now, Aronda Smith-Benson. Her book, Appreciative Inquiry, is something that we're going to talk about. But first, we want to talk about you. So welcome back to the show.
Well, thank you. Thanks for having me again. Yeah, thank you.
And so you and I were talking about it. It's been about 20 years that you've been on this journey before coming back. Let's talk a little bit about some of the things that you've learned and experienced and why it was important to come back.
Yeah, so I moved to Philadelphia. I'm a Houma native, of course, so I moved to Philadelphia over 20 years ago.
Right.
And that transition came about because I was living here in the local area, in the job market. At the time, you know, it didn't offer some of the things that I was looking for. So I decided to relocate to Philadelphia. And once I moved to Philadelphia, I worked in several different industries, starting with working with ex-offenders, federal, state, county prison system. I was also a director of a women's work release center there.
Right.
And then from there, I started to work with homeless women for some time. And then I ended up working with veterans. So I started 2 nonprofits for women veterans in Philadelphia, and did some other work as well in terms of veterans.
And that's kind of overlooking all of the service that you've provided. Tell us a little bit about what you learned through the service and quite frankly, why you're so invested in helping to take care of veterans, especially women veterans.
So I myself is a United States Army veteran. So during my service, I deployed during Desert Storm. And as a result of my services, returning home, I had some challenges, you know, maintaining stable employment, poor relationships, you know, friendships and families, 2 DUIs, you know, so later on, you know, I came to know that I was diagnosed with PTSD and anxiety and a mood disorder. So as a result of that, you know, I struggled for some time.
Right.
You know,
As so many of our veterans do, right?
Yes. But, you know, for me, something inside of me told me that thriving is a choice, you know, so I decided I wanted to thrive. So at that point, I went to traditional psychotherapy. And then psychotherapy, of course, the approach there is a more deficit-based approach. So I would go into therapy sessions and I would feel low. And sometimes I would come out feeling just a little lower.
Right. Because it was kind of problem focused, right? What are
Very
your
problem
problems?
focused, very deficit focused, you know, so you can't see yourself, you know, outside of that, you know, and I get it. And I will say that I really appreciate the VA and the services they provided as well. So I ended up going through psychotherapy there. But the blessing is that I was able to have a therapist that was familiar with a more strength-based approach.
Okay.
So that was the blessing in all of this. And at the same time, I was a master's candidate at the University of Penn.
Right.
And I was introduced to Appreciative Inquiry, which is using a strength-based approach. It started out with organizations. So I was studying in terms of organizations.
Okay.
So I was like, what if I apply this to myself? And at this, again, working with the therapist, and she and I came to agreement. So we used a totally different approach and then how my sessions would look in therapy.
And so it's interesting, you kind of changed the framework of your own personal experience based on what you were learning at school.
Yes, certainly. So that's what I did. I said, you know what? She and I talked, and we spent several sessions in terms of how we can use that framework that, again, had been successful in many organizations. David Cooperrider, let me preface that by saying that he's the person that developed AI.
Right.
AI. So if anyone wants to look anything further, other than get my book, you know, it's plenty of information in there.
Right. It references that quite often, in fact.
Yeah, so you can find a reference there in the book. But David Cooperrider is a developer of AI. So she and I, we did our own studies and throughout the sessions, and we were able to formulate something that worked well for me. Yeah. And 2 years later, you know, after 2 years of consistent psychotherapy, came out better on the other side, you know, and then I went and used the same approach when I worked with the women veterans.
Right.
And then, of course, that's how the book came about as well.
Right. And working with those, and you started those with those programs, and a lot of accolades over in Philadelphia about that. right?
Yeah. So in Philadelphia, I received quite a few accolades in terms of the work I've done with veterans, in terms of my services that I provided, within the veteran community. I was one of the City Council Veteran Advisory Commission, the commissioners.
One of the first women to do that, right?
Yeah, one of the first women, and probably I think the youngest as well. So I was can't think of all of the I can't think of some of the others
Right.
right now, but I mean many accolades. I
Right.
had the opportunity to work with the former First Lady Michelle Obama
Okay.
for a career symposium in Red Book magazine. So that was exciting. So different things, throughout my service to veterans. That was, honored for.
Right.
But to me, it's more precious just to do the work. And that's what's most memorable. You just see
Right.
people thriving now,
Right. And all I meant by the accolades is that people were starting to recognize how far you'd come. People were starting to recognize the work that you were doing, and you knew how far you'd come. And it's really interesting that you would be able to take this situation that was a challenge and see it as, if I focus on my strengths, I may be able to do so much more than just trying to correct a problem. You've really taken this kind of perspective. I love the idea that you took it from what is it that's been challenging you about how you can build a framework to help others. Let's talk about the formation of the book and how that came to be.
So the book came about, as I kind of discussed in the last segment. So it came about as a result of me going through psychotherapy and using that more deficit-based, problem-based approach that's commonly used in psychotherapy. But for me, I needed a little something different. So I was exposed to Appreciative Inquiry in my master's program at University of Penn. Again, when it's introduced in that program, it's introduced in how you use a strength-based approach within organization for better performance,
Right.
to shift a culture and those sort of things. So
And outcomes.
better outcomes,
Right.
right? So, but those outcomes come by way of focusing on what the organization does well.
Right.
So for me, I started, once I really got engaged into it, I was like, well, wow, why can't they use that with individuals?
Right.
So at the same time I was the director of the Women's Veterans Command Center. So I said, you know what? I talked to the director of our program, and I said, I think I want to do my research for my master's thesis on using this approach with women veterans. So that's how it actually came about.
And it was research that basically was groundbreaking in as much as there wasn't a whole lot of it. You had to go and start finding out how women kind of responded to these things, especially women veterans. Not a whole lot of research on that, right?
Right, definitely. So when I started to do the research, what I found was that there was a lot of research out there, but it was a lot of problem-based research on veterans just in general, and it was very little research when it came to women altogether.
Right.
So I'm saying that I know there are a lot of veterans out there that are thriving. We don't hear those stories, and we rarely see those stories.
Right.
So I wanted to also, in approaching the topic, also be able to change the face of what a veteran looks like. There are veterans out here that are successful and that are thriving as well.
And now you come back to Homa and you give the opportunity with a resource center for people to be able to look into the options to dream big.
Of course, yeah. So that's the goal, is to use the AI approach, and this AI is Appreciative Inquiry, but to use that as a coaching practice to work with veterans, and I work with non-veterans as well.
Sure.
But for this conversation, in terms of working with veterans, to offer that practice in support of the psychotherapy, because the psychotherapy is needed.
Sure.
So let's not minimize that at all.
Right.
That's definitely needed. That helped me to get where I am today as well, the psychotherapy. But use it as a complement to psychotherapy, using a strength-based coaching approach.
Yeah, it's worked for me as well. As a social worker, I found myself coming through some of the crossroads of life going, you know what? Maybe I should talk to somebody. And that's one of those things. And I love the fact that they did the very same thing. They asked, much like you did this week, talking about with other coaches, what are your strengths, but what is it that you're bringing to the table? What is it that you, as an individual, how your approach is to help others? It makes a difference for how they kind of respond in that didactic perspective.
Right, because I think it's important as practitioners, whether you're a professional coach or psychotherapists, psychotherapist. So you're in the situations when you're working with people one-on-one, you have to be able to identify what are you bringing into the session as well as a practitioner. I think that's very important. So I think one of those things that's key is for practitioners to identify what their strengths are as well. And are you modeling those type of things in the session when you're working with your clients?
Right. And so it really makes a difference. And so the book can make a difference as well. So let's talk a little bit about what your hopes are for the book and what it's going to do for people, what it's going to do for veterans, for women veterans, and what it's going to do for people in general.
Yeah, so my intent, my goal with the book is to, I've had some contracts with the VA administration. I worked in their compensated work therapy groups. So I was contracted with them to work with veterans that had been out of the workplace for some time.
Okay.
Most of them was due to substance use or some mental health concerns.
Sure.
Some documented mental health issues that they had. So I would go in and I would do some one-on-one coaching and some group coaching. So the goal is probably to be able to work again within the VA system, again, to have appreciative inquiry coaching to complement, what we're doing in terms of mental health within the VA system.
And so seeing where some people have had some of those challenges, seeing where they've gotten some help, and just kind of reshaping, if you will, how we look at what the future is going to be, right?
Yes.
And helping them see that as a possibility.
So one of the things I want to say that's kind of important, if there's any coaches out there listening.
Okay. And we have about a minute left.
And in coaching, one of the things we normally do is identify goals when we start to work with a client. So what makes AI coaching a little different in that regard? We always start with a topic instead of a goal, because even a goal can have a person in a position where they say that's something to work toward.
Right.
So
or some pressure.
We want, and it applies that type of pressure to them. So with the AI coaching, you want to just get a topic, and then we want to take the topic and we want to reframe it into something positive before we begin to set goals for the client. So
I love it. And it's about taking this one idea and really kind of building on it and just kind of reshape how you look at it.
Yes.
Interestingly enough, some of the research for the background for AI was about the language that we use too.
The language,
using positive language versus negative language. And as we close, I'm very happy about what it is that you're doing to make a positive impact on our community. And congratulations and support for what you're doing.
Yeah, thank you, and thanks for having me. And remember, thriving is a choice.
Absolutely. Thriving is a choice. And you've heard it right here from Aronda. Check out her new book. It's called Appreciative Inquiry, and you can find it anywhere, easy to find online as well, or come and look her up here in Houma. That'll do it for this particular segment of Bayou Time. Don't go anywhere. A lot more local programming when we continue.